Hey everyone, Bridget here at the AAFE Training Center. We are just treating my patient today with some lip filler. I'm using Juvederm Ultra today, and I always backfill all of my lip filler into ComfortTox syringes so that it, one, keeps my syringe sterile if I have to use it at a later date to do any enhancements, and I just think it's easier to inject with. So obviously I cleaned this patient really well. We numbed with topical cream for about 10 to 15 minutes. And then also I like to go through, like, obviously she signed consent and I went through all of the education, what to look for, including any kind of concerning, spots that could be a vascular occlusion or vascular compression. So she is aware of all of those, and she actually had never gotten lip filler before. So she was really, really excited. So as you can see, I'm kind of coming in through the vermilion border, which is, we call that technique right angle. And it basically, if you can see how the right side that I've already done is kind of showing more lip, it basically just brings the lip up more, creating more show, which also it gives you volume since it's filler, but it really helps to bring that lip up and out. I'm making sure to not go through the border, but actually right below it, so I'm still in the pink part of the lip. If you go in through the border, it can sometimes cause migration as you're injecting filler outside of the lip at that point. So you can do right angle across the entire lip like I'm doing, or you can just do it in certain spots. She kind of wanted more show throughout, like, her entire lip. So I made sure to go all the way across, and on the bottom I kind of do a similar technique. So now I'm going in with some standard volume and really just giving her some hydration along with the volume she's looking for. So I'm making sure to avoid that wet-dry line, as that is not a desired outcome when filler gets into the wet-dry line. And now I'm moving on to the bottom and doing some standard volume here. As you can see, I'm injecting pretty close to her vermilion border on the bottom, and that kind of does a similar thing that right angle does. It helps bring the lip out and then also gives that vermilion border a little bit of a pop. So same thing on this other side, entering really close to that vermilion border but staying in my pink bed, checking my depth. It's perfect. You can see the white outline, but you can't see any silver of my needle. When I go up kind of in this diagonal shape, it helps to emphasize her two little pillows that she loves on the bottom lip. So I'm now moving more into the corner, and I always make sure to not, inject as much product out here as I did in the middle, just because most patients want that middle pout and they don't want any excess filler on the corners. And you can just see how nice of a shape she already has. I'm basically kind of going in with the product everywhere first, just to make sure she's numb, because there is lidocaine in the product, and then I can go back and kind of be nitpicky and put things where I want them. Another reason why I like to backfill in these ComfortTox syringes is because I feel like it's really easy to get in the exact area that you want. Sometimes I feel like the needles in the syringe that comes with the filler is kind of bulky, so I feel like with the ComfortTox I can really get into small little areas, whereas with the normal syringe I feel like I struggle a little bit. So that's why I really enjoy backfilling. So here you can see I'm kind of going back to the top lip and filling areas where I really see any deficits, or this lip, like on this side, looks a little dehydrated, so that's the main reason why I'm going back in here and filling that area. Her main goals were obviously some volume and hydration, but also she really wanted her vermilion border to pop, and then also a really defined cupid's bow. So that's kind of why I'm going in here and really like almost creating a little bolus at the top of her cupid's bow, which helps peak it. And then I will do the same thing on the other side. The reason I chose Juvederm Ultra for this patient is because, one, she had never had filler before, so I felt like Ultra Plus would be a little bit much for her. And then also, we also use Revanesse products here. I just really like how Juvederm is really easy to shape and create that defined cupid's bow. So it's just kind of my preference, but that's kind of why I picked the Juvederm products for her. So as you can see, she's creating a really nice shape with this lip, and she's getting the desired result. You can see that right cupid's bow is peaked a little bit more, so I'm going to do a little bit more work to try to even those out. But I'm really liking how the shape and how hydrated, especially the bottom lip looks. And she actually is coming back for her follow-up today. And I'm anxious to see what they look like about 2 weeks later. So as you can see, I'm kind of coming back to this left side like I was saying earlier, just to kind of even out with the right side, and just going back into those corners where I didn't add enough product and I really wanted to keep them hydrated. Also, with all of our lip filler syringes, we give a Comfort Tox post lip care kit, and those are really great. It comes with a serum and a balm, and it has arnica, essential oils, really great things for healing and bruising and swelling. A lot of our patients really like it and actually continue to use it past the healing time, so that's really great also. And as you can see, I just did a right angle injection on the bottom to just try to, again, even out that vermilion border on the left side to try to even it out with the right. So as you can see, I'm just kind of evening things out. I'm being really meticulous in placing the filler. I did have some left over, so if she needs more in 2 weeks, we can definitely give her a little bit of an enhancement. Now I'm going through with some gauze and I'm just massaging that filler and placing it where I want it, making sure that there's no like significant lumps or bumps. It can be normal for her to feel some lumps and bumps for a couple weeks, but I want to make sure I don't feel them on the outset. As you can see, I am now putting that Comfort Tox lip balm on like I was talking about earlier, and it just creates a really beautiful shine, especially for like after photos. It just looks really great when you put the before side by side. So you will use this serum and balm at least 3 times a day, and this is kind of what I'm telling her in this video. And we don't want you to use any other products for the first 3 to 5 days, just because we want you to put something clean on. We know this is clean. Each package is each patient gets their own packet. And patients really seem to like it. My friend actually still uses hers months later, and she just really enjoys the product. But as you can see, they look so beautiful, and she is so happy with the result. So you can learn this too by getting AAFE certified and taking our Botox dermal filler and many other courses that we offer. Thank you.